Hi guys, how's it going? Just give a few more minutes before I start. Welcome to all who are joining. Hi Ken, hi Brad, how are you? I hope you guys have had a lovely day. It's nice we're finally over Wednesday. Only a few more days until the weekend. Hi Chris, how you going? I'll give it one more minute and then we'll get started. I think this topic is particularly relevant to many of us. So I'm excited to have this discussion. Okay, why don't we get started? Welcome everyone who has just joined. My name is Dr. Chelsie Rohrscheib. I am the head neuroscientist and sleep specialist at Wesper. We are a sleep health company, and I like to do these seminars once weekly just to provide some information and some education behind dealing with sleep apnea and living with sleep apnea. Okay. If the quality isn't great, please let me know and I will try to adjust that for everyone. Okay, so today's topic, I am going to explore using a CPAP and how that affects your self-esteem and also your dating life, because this is kind of a difficult thing to navigate for a lot of people. You know, when you have sleep apnea, you know that, your best option is going to be oftentimes to be on that CPAP to stay healthy. But, nothing is super fun about, trying to use a machine and a hose and a mask and also trying to maintain a relationship or trying to get into a dating life. So it's pretty common that people feel really self-conscious when they first start using their CPAP, and they're not really sure how to boost their confidence levels. So first, I would like to dive into how you can build up your self-esteem when you first start using your CPAP. And then afterwards, I'm going to talk about how to navigate the dating world when you have to use a CPAP every night. So let me start off by just giving you a little bit of information if you don't know that much about sleep apnea or about CPAP usage. So sleep apnea is one of the most common sleep disorders in North America. Sleep apnea occurs when you stop breathing periodically throughout the night. So this can either happen because you have an obstruction in your upper airways, or your brain doesn't tell your lungs to continue breathing throughout the night. Now, the large majority of people have obstructive sleep apnea, not central sleep apnea. And most people who are on a CPAP also have obstructive sleep apnea. And that's about 20% of the population. So it's not a small number. So, there's really no question why using a CPAP machine can affect your self-esteem. I mean, it's a bit of a clunky device if you think about it. It's a machine that you have to plug in every night, and you have to wear a mask, and it attaches to a hose, and it can make sleeping very difficult at first, and it can kind of be weird when you're introducing it to new people. So let's talk about why you should actually feel more confident when you're actually using your CPAP to treat your sleep apnea. So number one, being healthy is super sexy. So we all know that being in excellent health, keeping yourself in shape, and making sure that you're eating healthy and exercising is a very attractive trait. one thing that people with sleep apnea have to keep in mind is that there's a lot of negative health effects when you have sleep apnea that remains untreated. Let me see. People are telling me I am freezing. So let me see if I can fix that. Hopefully that continues to work. Let me know if you guys are getting some freezing here. I'll try to change my camera. Okay, let's get back into it. So sleep apnea can have a lot of negative health consequences. First of all, it sleep deprives you. This is because every time you stop breathing at night, your blood oxygen levels will go down and your carbon dioxide levels will go up. And this will trigger your brain to wake you up to recommence breathing. So if you think about it, if you are constantly, having these oxygen drops, which is very typical of somebody with active sleep apnea, you're really going to be in a very light state of sleep, or you're going to be awake for most of the night. This is why people who have sleep apnea can sleep 9, 10, even 11 hours and still feel exhausted the next day. It's because they're really not getting that deep restorative sleep that they need. And so being sleep deprived itself has many negative health consequences. It raises your risk for various chronic health conditions like cardiovascular disease, cancer, mental health problems, diabetes, you name it. Sleep apnea also plays a big role in your sexual health. So people with sleep apnea tend to be at higher risk for sexual dysfunction or just having a low sex drive in general. It's also difficult to maintain your general health, so your weight and your energy levels. And this is not necessarily the most attractive state to live in. So going on that CPAP machine and using it consistently is going to allow you to get the sleep that you need, and it's going to really reduce the risk for all of those chronic diseases. Okay. Number 2 is you're going to have more energy when you're on CPAP. And again, this goes back to not being sleep deprived all night long. But, it also affects the rest of your body. It affects your metabolism. It affects your energy levels in general. And this is going to give you the ability to go out and socialize and meet people and go on dates and just have a really fulfilled life. When you're low energy, your mental health can also dive really quickly. And that's going to really affect your self-esteem and just how you feel about yourself in general. So using your CPAP consistently is going to help you maintain those energy levels that you need to go out into the world and feel fulfilled. Okay, number 3, this is probably one a lot of people are interested in, and that is weight loss. So it's pretty common knowledge that sleep apnea can be associated with being overweight. Well, that is true. Not everybody who has sleep apnea is overweight. However, having sleep apnea itself can put you at higher risk for gaining weight. And the reason for this is because sleep apnea, again, this goes back to sleep deprivation. When you're sleep deprived, your hormones that regulate how hungry you are during the day get unbalanced. So these are 2 hormones called ghrelin and leptin. And when you're sleep deprived, they get kind of out of whack. So the hormone that makes you feel full and satiated doesn't really kick in, whereas the hormone that makes you feel hungry and make you want to reach for a meal is at its highest. So you're going to be more inclined to feel hungry and reach for food throughout the day. We also know that chronically sleep deprived people also tend to reach towards more high caloric foods and also sugary, high fat foods, which in itself is going to be more likely to make you gain weight. On the other side, there have been clinical studies that have also shown that being chronically sleep deprived, especially when you have sleep apnea, reduces your metabolism's ability to properly use and burn calories. So we know from studies that if you took 2 groups of people, one group who has enough sleep and another group who's sleep deprived, and feed them the same exact meals, no differences, the group that is sleep deprived is going to gain weight, regardless of how different or how similar the food is to the people who are not sleep deprived. So the people who aren't sleep deprived don't gain any weight, and the people who are sleep deprived do gain weight. So that combination of factors make it a lot more likely that you're going to pack on the pounds, and it's also going to make it more difficult to lose that weight. So generally what we see is people who are placed on CPAP and are consistently using their CPAP over a few months, or like 3 to 6 months, can expect to see some weight loss over that time. And you're also going to see that you're eating healthier and you're not craving that high fat, high sugary food that's making you gain weight in the first place. Okay. Number 4, higher sex drive. And we kind of already talked about this, but sleep deprivation and sleep apnea have a massive negative effect on your sex drive for various reasons. The first reason is you're just tired. Nobody feels particularly sexy or is particularly interested in getting intimate when you're overly tired. The other reason is that sleep apnea really disrupts our sex hormones. So these are hormones like testosterone for men, estrogen for women, that really are important to maintain our sex drive. We also know that men with untreated sleep apnea can also have performance issues. In particular, they're at a higher risk for erectile dysfunction. So when you properly treat your sleep apnea and you're getting the sleep that you need, and you're also keeping your oxygen levels up, you can expect your sex drive to massively improve. Okay, let's see. Chris said, I lost 20 pounds, 40 more to go, and I can likely get off this machine. That's so great. That's good news. So the machine is definitely helping your weight loss. I can almost guarantee it. So that's fantastic. Great news for you. Okay. And finally, why you should, allow your CPAP to raise your self-esteem is you're going to just look better in general. When, nobody looks good when they're sleep deprived. Even supermodels don't look great when you're sleep deprived. You look haggard, you've got bags under your eyes, you're bloated, you're, gaining water weight. It's just a very unhealthy, unpleasant look. So just by getting enough sleep alone, that's going to really raise your looks. It's going to make you look healthier. It's going to make your skin glow. You're just going to give off this presence that's going to be a lot more attractive. Okay, so CPAP and Esteem. So healthy is sexy. You'll have more energy. You'll probably lose some weight. You'll have a higher sex drive, and you'll look better. So take all these things into consideration, and your esteem is going to skyrocket. So next, let's talk about dating and CPAP. So this is a little bit trickier because obviously, like if you're new in the dating field and you're just meeting these people and you don't know how they're really going to react to the fact that you have to use a CPAP at night, it's a little bit scary. And I think most people with medical issues are always worried about telling a potential love interest that, they have this issue and this is how it's being treated, and being really honest and straightforward with them. It's scary regardless of what medical condition you have. And then adding the CPAP on top of that, it's this big bulky machine with tubing and a mask, and it can be very off-putting sometimes. So the best thing you can do is use a few techniques when you're getting to know somebody or you're interested in potentially moving forward with somebody in a relationship. So my very first tip is to just be super honest and upfront. I'm not saying that you need to tell them you have sleep apnea and you use the CPAP on the first date. Maybe wait a few dates, but before you take it any further, just be really straightforward. Like, look, I have this sleep disorder. It's super common. 20% of all Americans have sleep apnea, and most of those individuals are treated with CPAP. So it's not unusual. Tell them, why it's important to be on CPAP. It keeps me healthy. It keeps me active. It keeps my energy levels up. I probably won't go on to get these chronic diseases that are associated with sleep apnea. It's going to let me live a better life. It's going to let me be more attentive in this relationship. So just be honest, don't sugarcoat it. Don't surprise them when they come over to your house the first time. Give them a little bit of a heads up so they know what to expect. You'll be surprised. Most people are going to be super understanding, as long as you give them some time to just kind of think about it and process it. They're not really going to care. Most people know what sleep apnea is, and most people have heard of a CPAP before. So it's not going to be totally shocking. Number 2 is hit them with the facts. So instead of directly going to emotions and, playing on their emotions, just give them the straight facts. Be super logical about it. Give them the statistics about how many people in America have sleep apnea and how common CPAP is. Tell them about the machines. Now they're super quiet. They're a lot smaller than they used to be, and they're not as invasive as they used to be. Tell them that you have this disorder. It's not uncommon, and it is something that I need to have to stay healthy. If I don't use my CPAP, I won't be able to maintain my health. So, playing to somebody's logical side is going to help you in the long run. Number 3 is give them a heads up with pictures and videos. I'm not saying send them a picture of you wearing the CPAP or a video of you using the CPAP, but you could just show them a picture of, a general CPAP. You can just pull something up on Google Images or send them a video on YouTube of somebody using a CPAP machine. This is so they can actually see it before they have to see it in person. So, give them a heads up. Again, this is all coming back to giving them enough information that they can kind of absorb it, think about it, let it, work its way through their minds before they actually see you using it in person. That way, when you do have your first sleepover and you need to put your CPAP on, it doesn't totally shock them and they know what to expect. And if they have questions or concerns, be totally free with your answers. Give them all the information that they need, or you can refer them somewhere, online, like the Sleep Foundation, so they can get some more information. Number 4, tell them exactly what CPAP does for you. So before I told you just hit them with the general facts about CPAP, but this is where you can play to their emotional side a little bit and tell them how CPAP has personally improved your life. Maybe give them a little background about, how you were struggling with your sleep apnea before you were even treated, what it was like to be sleep deprived all day, every day. How it affected your health and how this has really improved and changed your life. A good quality person that could potentially be a partner is going to embrace anything that makes your life better. Somebody who rejects it or, scoffs you off or doesn't want to date somebody who uses the CPAP is probably not a good person, a good quality person that you'd want to be with in the long run. Be with somebody who is going to be supportive and open and caring and wants you to be the healthiest version of yourself. And finally, let's talk about CPAP and intimacy. So this is something people don't think about or they forget is CPAP doesn't have to ruin your intimacy with your partner. Just because, you wear CPAP at night, you need it to go to sleep, doesn't mean you still can't be intimate in the bedroom. Remember, it's always okay to take your mask off whenever you want. Turn off your machine whenever you want. Put the machine away. It doesn't have to get in the way of the romance with your partner. So just keep that in mind that yes, it is something you need to use while you sleep, but it doesn't have to affect the other areas of your life. And again, I think, if you are dating somebody who is a really good quality person who cares about your health and well-being, they're not going to care that you have a CPAP in the room or that, you need to remove a mask when you want to initiate some intimacy. So those are all of the ways that you can allow using your CPAP and treating your sleep apnea to boost your self-esteem and some ways to just navigate your dating life. And thank you so much for listening. And I guess right now I'd like to just take some time to answer any questions you have about sleep apnea, or we can talk about this topic or really any topic related to the sleep disorder. I'm happy to answer any questions. I'm assuming many of you actually use CPAP or are thinking about using CPAP. Have any of you run into any of these issues before? Are any of you actively dating right now while trying to navigate the world of sleep apnea treatment? All right. Well, I think it doesn't look like we have any questions tonight, which is totally fine, guys. Oh, have any of your patients gone off of it? Yes. So it depends on what's causing your sleep apnea in the first place. So there's many reasons why somebody can develop sleep apnea. There's been a stigma for a really long time that only really unhealthy people go on to develop sleep apnea, but it's actually common in all demographic groups, from young, super healthy athletes all the way up to, of the older population that maybe aren't so healthy, to middle-aged individuals, to children. Even children are getting sleep apnea now. So depending on what is causing your sleep apnea in the first place, you can eventually go off CPAP. So for instance, if you're a little bit overweight and you've got some excess tissue around your throat and that's what's causing your blockage, losing weight can often help you reduce or eliminate your sleep apnea to the point of being able to go off CPAP. Various surgical procedures that are available now can also fix some issues in your throat. For instance, this is just an example. There's over 20 different surgeries available now for sleep apnea. But for instance, let's say you just have really big tonsils and they're causing those blockages. Getting your tonsils removed could definitely allow you to go off CPAP. People are starting to do tongue and throat training exercises now to strengthen those muscles. I've seen people get off CPAP that way, or just going on to other therapies. So instead of using CPAP, going on something like an oral device, like a mandibular advancement device, or the new Inspire device, which is the electronic implant that goes in your chest and stimulates a nerve in your neck. So again, it totally depends on what's causing your sleep apnea in the first place. It is possible. Not everybody will be able to get off their CPAP, but a good proportion of people can eventually transition off of CPAP. What is the next generation machine? Yeah, so that's a really good question. The CPAP machines, and I shouldn't call them CPAP because not all machines are CPAP anymore. When I say CPAP, I mean continuous positive airway pressure. There's also APAP, which is auto pressure, and that means that it changes up and down depending on how much pressure you need at any given time. Most doctors are prescribing APAP nowadays because they're gentle. There's also BiPAP, which has two different pressures. So it has the pressure you need to keep your airways open, and then it also has a gentle pressure that allows you to exhale when you're breathing out. So most machines are going to be a combination of maybe like a CPAP and APAP or CPAP and BiPAP. Most people will ultimately end up on an APAP. The machines are also much smaller and much quieter than they used to be, and they'll continue getting quieter and smaller as we go on. They also have really great features like the humidifier on them and the ramp feature, which allows you to press a button and it lowers your pressure down and kind of ramps up over time, so it's easier for you to fall asleep. Next gen CPAP machines are also going to be more portable, so it's going to be easy to travel with them. The masks will be more custom fit to you as well, so they won't be as bulky and uncomfortable. So it's really going in that direction, and it's very exciting. What are your thoughts on oral appliance therapy? That's a really good question. We're kind of going into an oral appliance therapy direction now. So before, doctors heavily prescribed CPAP to people regardless of how severe their sleep apnea was. So people who had mild sleep apnea were prescribed CPAP, and people with severe sleep apnea were prescribed CPAP. But we're understanding more and more as we study the disorder that people with mild sleep apnea, even moderate cases of sleep apnea, don't necessarily have to rely on a CPAP. There's other options. I mean, one of those options is something called a mandibular advancement device. And this is essentially an oral appliance that you wear at night. It's kind of like a mouth guard, but not quite, because it holds your jaw in one position, so you can't really move your jaw around. But the way it works is it moves your lower jaw just slightly forward, and this helps you maintain tone in your neck muscles, and it also brings your tongue forward too. So when you are sleeping and when you are relaxed, it's less likely that your tissues collapse in on themselves and cause those blockages. So mandibular advancement device and other similar oral therapies are pretty darn good at treating people within the mild to moderate range. You do have to see a dentist that specializes in sleep breathing disorders in order to get one. It does involve a prescription, just like CPAP. And then your dentist who specializes in sleep apnea would evaluate your upper airways and see if you are a candidate. And most people are, I have to say. It's usually not appropriate for severe sleep apnea. So that means people who stop breathing on average 30 or more times per hour. And I would say it doesn't do as well in the high moderate range. So it can usually reduce your sleep apnea events by about half. So that should be the minimum reduction you should get. Okay. But I will say, if you are absolutely struggling with getting used to a CPAP, or you're having too many side effects, you should definitely talk to your doctor about potentially evaluating whether you would be a candidate for something like a mandibular advancement device. Okay. Does anyone have any other questions? All right. The other options are, of course, surgery, and then there's the Inspire device, which is a partial surgery. You have to have a surgery to implant it. And I think as time goes on and more research is done, more sleep apnea therapies will become available. Okay, guys, thank you so much. Just a reminder, my name is Dr. Chelsie Rohrscheib. I'm the head sleep specialist and neuroscientist at Wesper. That's Wesper, WESPER.co. We are a sleep testing company. If you're interested in learning more about our sleep testing, you can check out the link that I put below. Okay. Oh, one more question from Chris. But as you lose weight and strengthen your muscles, you can go from severe to moderate? Potentially. Yeah. It's potential. It's not a guarantee, because you have to consider other things at play. So your anatomy, the anatomy of your airways, will also contribute a lot to whether you can get your AHI, or that's the average amount of times you stop breathing per hour, down. So for a lot of people, strengthening your muscles, losing weight is going to help, but there's no guarantee that it will completely, reduce your sleep apnea or eliminate your sleep apnea. So just keep that in mind, that you may see some results, but it's never guaranteed. Okay, guys, I will let you go for the evening. I do these seminars every week, so every Wednesday at 8:30 Eastern Time. I'll see you next week, and thank you so much for joining.